Peripheral Artery Disease Explained, a comprehensive guide by Medickpidia milk and butter, hot cocoa and pastries, fuzzy socks, and a roaring fire. There's nothing quite like the holidays spent indoors curled up on the couch binge-watching TV shows. But wait, why does my lower leg hurt so much when I walk? It's always worse after sitting for a while. And sometimes it feels like pins and needles shooting through my calf muscles. Could this be normal? Unfortunately, no. While these symptoms might seem like just another ache from too many family gatherings and holiday feasts, they could be something more serious. Maybe it's just old age, right? Well, maybe not. You see, it could be a sign of a sneaky yet surprisingly common vascular condition known as peripheral artery disease, or PAD, and I'm here to tell you all about it. Hello and welcome back to Medickpidia. Have you ever heard about peripheral artery disease, or PAD? Well, today we're diving deep into this serious but often overlooked vascular condition, a disease that affects millions globally and can have life-changing consequences if left untreated. Stick around for the next 20 minutes to learn what PAD is, how it can sneak up on you, why early detection is key, and most importantly, what you can do to prevent and treat it. First things first, what exactly is peripheral artery disease? Put simply, PAD occurs when the arteries, especially those outside your heart and brain, often in the legs, become narrowed or blocked due to a buildup of fatty plaques. This process is called atherosclerosis. As the arteries narrow, less blood reaches your limbs, leading to various symptoms and complications. Now you might be wondering, what's the difference between PAD and other types of vascular diseases? Well, PAD is a type of peripheral vascular disease, targeting arteries that supply blood to your limbs, while other vascular diseases may focus on veins or occur in different parts of the body. Now let's talk about the elephant in the room. What causes PAD? Well, the #1 culprit is atherosclerosis, the hardening and narrowing of arteries from the buildup of fats and cholesterol. But that's not all. Other contributing factors can include chronic inflammation of arteries, vasculitis, blood vessel injuries or trauma, and blood clots. Alright, now that we know what causes PAD, who's most at risk? Well, age over 65 is a big one. The risk doubles every decade after 50. And yes, smoking, including past smokers, is the strongest risk factor. Other risk factors include diabetes type 1 or 2, high blood pressure, high cholesterol, obesity, chronic kidney disease, and a family history of cardiovascular disease, or PAD. But how do you know if you're at risk? Well, here are some signs and symptoms to look out for. Does your leg or thigh hurt when you walk or go up a flight of stairs? Or perhaps you notice numbness, weakness, or heaviness in your lower leg or foot, especially when compared with the other side. Do you have coldness in your lower leg or foot? Again, especially when compared with the other side. Have you noticed any sores on your feet or legs that heal slowly or not at all? Do you have a change in color of legs, like paleness or bluish tinge? Shininess of the skin, along with loss of hair on the lower legs or thick, brittle toenails. And lastly, in men, erectile dysfunction can be an early warning sign of PAD. Remember, not everyone with PAD will have symptoms, so it's essential to stay vigilant and consult your doctor if you experience any concerns. Speaking of which, how is PAD detected? Well, diagnosing PAD is relatively straightforward and often non-invasive. Your doctor will begin with a physical exam and discuss your symptoms and risk factors. They'll also measure your blood pressure in both arms and both legs to calculate the ankle brachial index, or ABI. This simple test compares blood pressure readings in your ankle and your arm. An AB value of 0.9 or lower suggests the presence of PAD. If the AB is borderline or there's clinical suspicion of PAD, further testing may be recommended. Ultrasound, also called Doppler, can check blood flow in the arteries. Angiography, on the other hand, uses dye and imaging techniques like X-rays or MRI to pinpoint blockages or narrowed areas in the arteries. Additionally, blood tests can evaluate your cholesterol levels, blood sugar levels for those with diabetes, and kidney function. Early detection is crucial because many people live with PAD for years without knowing it. Untreated, PAD can lead to serious complications like non-healing wounds, ulcers or gangrene, and even increase the risk of heart attack and stroke. So it's important to schedule regular checkups with your healthcare provider and be proactive about your vascular health. Now let's talk prevention. What can you do to lower your risk of developing PAD? Well, the good news is that many of the steps to prevent PAD are similar to those for overall heart health, so it's a win-win situation. First and foremost, if you're a smoker, it's time to quit. This is the single biggest thing you can do to reduce your risk of PAD and other cardiovascular diseases. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Even a simple daily walking routine can work wonders for your vascular system, improving blood flow and reducing pain associated with PAD. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Limit saturated and trans fats, cholesterol, and excessive sodium intake. Maintaining a healthy weight is also crucial for cardiovascular health. So watch your waist zone. Manage stress through relaxation techniques like yoga, deep breathing exercises, or meditation. And limit the consumption of processed foods and sugary drinks. By following these preventive measures, you not only reduce your risk of PAD, but also improve your overall health and well-being, so it's a win-win situation. However, if you do develop PAD, there are ways to manage and even reverse its effects. Lifestyle modifications such as a heart-healthy diet, regular exercise, and smoking cessation are fundamental. These measures can help control risk factors, improve circulation, and reduce symptoms. Medication plays a vital role in managing PAD. Statins, for example, are a class of drugs that can help lower cholesterol levels and stabilize atherosclerotic plaques. Antiplatelet agents like aspirin or clopidogrel can help prevent blood clots, which can worsen symptoms or lead to complications like stroke. Silostazol is another medication that can aid in the treatment of PAD by relaxing blood vessels and reducing platelet aggregation. However, it's not suitable for everyone, particularly those with certain heart conditions. For individuals with more severe PAD, advanced therapies may be necessary. Angioplasty and stenting are minimally invasive procedures to open clogged arteries. During angioplasty, a balloon is inflated inside the narrow artery to compress the plaque against the artery wall. Stenting involves placing a mesh-like tube called a stent to keep the artery open. On the other hand, bypass surgery is another option for treating severe cases of PAD. This surgery reroutes blood around the blocked or narrowed artery using a healthy blood vessel graft. Ultimately, the best course of action depends on the severity of your condition and individual circumstances. In rare cases where the damage to the limb is extensive and non-reversible, amputation might be considered as a last resort to prevent the spread of infection or gangrene. However, this decision is typically reserved for situations where other treatment options have been exhausted and the limb is at risk of becoming life-threatening. Remember, early detection and intervention are key to managing PAD effectively. Make an appointment with your doctor if you experience symptoms, have risk factors, or simply want to learn more about vascular health. Pro tip: don't hesitate to join support groups or educational programs to gain insights. Share experiences and stay motivated on your journey to better vascular health. So there you have it. PAD might be a silent threat, but with the right knowledge, you can take charge. Stay informed, stay active, and stay healthy. And remember, you're not alone in this journey. Reach out to your healthcare providers, support groups, or online communities for guidance and support. Together, we can combat PAD and promote overall vascular health. If you found this video helpful, please hit the like button, leave a comment below with your questions or stories. And don't forget to share it with anyone who might benefit. Subscribe to our channel for more top-notch medical insights. Thanks for watching. Until next time, stay healthy and informed.